Okay, causes of cognitive decline. So looking at these causes that have been known in the health circles, one being inflammation. Inflammation from infections, and it's been known in the health field too that viruses related to infections can actually be behind the amyloid plaques that have been known in patients or folks with Alzheimer's. So it's not just the plaques, but actually there could be a viral background that relates to the cause of those plaques. So if you help address the body's ability to handle those viruses, there's a good chance it can help with not the need for those plaques to develop here. So another things with inflammation is poor diet, diets that are high in sugar, gluten, processed foods, basically inflammatory diets have been known as a cause for cognitive decline. Decline of a shortage of key nutrients and hormones. Now, this is something I'm going to focus on one thing for tonight, and that has to do with nitric oxide. So I don't know how many of you are familiar with the value of nitric oxide, of knowing about that. So I'm going to just spell a few things out in that respect. So as we age, we lose 85% of our ability to make nitric oxide. And that's a relative thing. For some of us, it might be less, maybe even some of it might be more. But nitric oxide is required for red blood cell delivery of oxygen from the lungs to the tissues. Every single chronic disease is characterized by decreased blood flow to the affected organ or tissue. If you can restore blood flow and perfusion to every organ, tissue, and cell in the body, you can correct most, if not all, chronic diseases. And that's a big promise there. But the possibility exists as there's greater blood flow and perfusion of oxygen, that things can rise up for the body. Well vascularized tissue are more resistant to infections. By contrast, poorly vascularized tissues are relatively inefficient in responding to inflammatory stimuli. So just in terms of infections, inflammation, if we're well vascularized, there's more resistance to infections. Number 3, toxic substances and conditions. Okay, now as I go along here, you may want to take some notes and then jot down if you have any questions, because during the time we can discuss those together. Okay, number 3, toxic substances and conditions. So heavy metals, things like mercury, lead, aluminum, fluoride, they have to use metal contaminants in order to make fluoride. And fluoride is added to a lot of our drinking water supply, and it's been known to accumulate in the pineal gland. Now, as a chiropractor, we've taken x-rays of skulls, and we noticed there's calcification in a number of people on their pineal gland, which could relate to fluoride intake for those individuals. And there's actually some films and documentaries in terms of how heavy metals actually shrink nerves and destroy nerves. Number 4, causes of cognitive decline. Unrelieved accumulated stress. So if our body is constantly on weathering stress patterns, things are going to wear out. So I'm going to be talking about that a little bit later in the presentation, but looking at the causes from a health standpoint, inflammation, decline or shortage of certain key nutrients and hormones, especially nitric oxide, toxic substances and conditions, and unrelieved accumulated stress. And in terms of toxic substances, now we're all being exposed to heavy metals in the air, in water, in the food that we eat. So we want to see what can be done to help lessen our exposure, but also help our bodies be able to detoxify those metals once they get into our system. So keeping our brain healthy. So, okay, those are the causes. What can we do to keep our brain healthy? So looking at lifestyle recommendations. 1, reducing lifestyle stressors as we can and establishing boundaries for mental well-being. Now, one thing with that is moderating our tech use. I don't know if you're aware, Yuki, if you can mute your line, or Robert, you can maybe mute Duki's line there.
Yeah.
Okay, great, thank you. Okay. So reducing lifestyle stressors and establish boundaries for mental well-being, moderate tech. So, basically there was neuroscientists who helped the cell phone industry develop vertical scrolling, which actually has an addictive tendency to our nervous system. So just, we all got to scroll, but being aware that that can have an influence if we do it too much. Enhancing brain health through prayer, meditation, music, be in nature, soft fascination time. Now, those are in the Conscious Healthy Aging program. There's core content that lends itself, that talks about soft fascination time. Basically, it's time where we can go out into nature or do something that actually allows our minds to kind of lessen the concentrated concentration attention focus we've been doing for a good part of the day, but it let our minds relax with soft vaccination. That could be in music or being in nature and various other ways. Optimizing sleep and incorporate regular times for relaxation. Consider a bedroom filter, air filter. So we spend most of our time, 7 or 8 hours, whatever, in our bedrooms there. And to help reduce toxic load is having a bedroom air filter as a thought, but also prioritizing our rest patterns, making sure we balance our rest activity patterns, but we look to have good restful times and to optimize our rest times. Stay socially active and engaged. So one of the number one factors, and actually James Maskell talks about this in his work, that the number one factor for quality longevity is a sense of community, staying engaged with others. Do at least 30 minutes a day of enjoyable exercise, include resistance training to increase BDNF, brain-derived neurotrophic factor. So that's a element in our body that we need to have good mood, but also have good sensing with our appetite. And one way of helping to keep those levels in a good level is through resistance exercise, weight training, or I like using actually tubing, elastic band, tubing bands, which are a little bit easier on the body. Okay, looks like we have a certified person coming into a room. Okay. Last one here, do brain enhancing activity exercises like crossword puzzles, Sudoku, language learning, drawing, painting. I know Robert's been doing some painting there and some watercolors. That's something very good to help with brain health there. Okay, so that's lifestyle recommendation for keeping our brain healthy. And then practice HeartMath and utilize the BrainTap app. So again, with HeartMath is a process there to help bring your body into its right heart rhythms, healthy heart rhythms that actually help our brain. And then for some folks who don't have the discipline to practice HeartMath, is to utilize something called BrainTap. And BrainTap actually sends good sensory input into the nervous system that kind of does it for you. Maybe not to the degree of actually doing your own conscious enhancing exercises, but to a certain degree of actually assisting your body to do it for itself. And we can talk more about that. And again, in the core content, I cover those bases. Okay, keeping your brain healthy, dietary recs. Okay, eat to improve and optimize gut health because the health system, you see here, of the digestive system is intimately connected to brain health. So our gut and our brain very much relate to each other. Eat a diet of unprocessed whole foods, abundant in organic, high antioxidant vegetables and fruits, especially berries that may improve short-term memory. Eat organic foods whenever possible. So again, we're also being exposed, but if we can eat foods that have less toxic content, that will help with our bodies. Support blood sugar balance by avoiding foods that spike blood sugar, such as high sugar snacks and beverages, including sodas and fruit juices, refined carbohydrates, and high fructose corn syrup. So it's important to avoid high fructose corn syrup. And when that is in foods, it's almost like a stimulant to keep eating where we just can't get satisfied. Now, in terms of blood sugar, Alzheimer's is being coined as diabetes 3. So there's diabetes 2, but the word is that as our blood sugar is in an unstable way, that can lead or set the stage for Alzheimer's to develop. Add healthy omega-3 fats such as raw walnuts, flax seeds, flaxseed oil, wild-caught oily fish, chia seeds. Avoid trans fats. Now, some of these things you might already know about, but it's good to reaffirm them together. Add healthy spices and herbs such as saffron, rosemary, holy basil, turmeric, oregano, cloves, cinnamon, and ginger to meals. Okay, again, these slides will be posted on the course site, so you can review these later if you'd like to. And then have adequate intake of choline through choline-rich foods such as liver, egg yolk, shiitake mushrooms, chicken, turkey, cruciferous vegetables, leafy greens, kidney beans. Okay, those have high choline, and choline's good for the brain. Additional brain health recs. Okay, check for underlying medical conditions. So various diseases have some of which you might be unaware of can be detrimental to your brain health, especially in the long term, like high blood pressure, pre-diabetes, diabetes, atherosclerosis, the clogging up of your blood vessels, leaky gut, too much abdominal fat, your belly, low-grade systemic inflammation, and so on. And that goes along with the medications. So some drugs can increase the risk of Alzheimer's disease or cognitive deterioration, like specific sedatives, antidepressants, antihistaminic drugs used to fall asleep or treat allergies. So those kind of things you want to see. If you are taking any of those, that that can have an influence on your cognition. Brain diagnostic markers. Okay, so how do we assess things? So I'm going to review a few things to consider for testing. Okay, one is when you get your blood test, have your doctor test you for homocysteine. Homocysteine levels are associated with increased risk of developing dementia, heart disease, and stroke. High levels can reduce the size of the hippocampus related to short-term memory decline. Check for what's called MPO, CRP, Cleveland Heart Labs. Now, these labs relate to the possibility, the vulnerability of maybe having a stroke or a heart attack. So you want to see what you can do to prevent those. And if you see what your levels are, you can see if they need to be addressed sooner than later. Blood sugar, again, you want to make sure your blood sugar is being checked with your A1C levels, your fasting insulin, your glucose levels. Again, there's the way to test your nitric oxide, there's saliva test strips. So you can actually purchase those on your own and check your own nitric oxide levels. Heavy metal testing using hair and urine, not so much blood. Blood's for a kind of immediate exposure, but you want to see if metals are actually stored in your system, in your tissues. And that can be especially noted through urine. And then a screening test you can use for hair for toxic heavy metal exposure. Brain span testing. Okay, brain span testing was developed by a doctor who worked in the services in Afghanistan in the army. And he realized that a lot of the soldiers were coming back with post-traumatic stress disorder. And so he started doing some work and they recognized him with others that checking folks' omega-3 levels had a lot to do with that condition, post-traumatic stress disorder. And then he expanded it into testing of a test that includes cognitive function. So there's a brain span testing that includes both of these, cognitive function as well as omega-3 values and levels in your system. Neurozoomer. Now, Neurozoomer is a testing for antibody testing for the brain and nervous system. Now, for the nervous system can actually be attacked by our own body by an autoimmune condition. So you want to see if you're building up antibodies to, say, your brain or your blood-brain barrier or your peripheral nervous system. So this test can actually test to see if that's happening. It also can test to see if there's viruses that are affecting your system that could relate to your brain and nervous system. So, any one of these tests might strike you, but or just one or a few of them, it's worth to consider what is available in this respect. Okay. Health genomic testing, including ApoE4 status. Now, I don't know if you're familiar with ApoE4. It's a gene test to see if you have certain what's called alleles. And if you have alleles with a 4 in it, there's a greater risk of developing cognitive decline, dementia, or Alzheimer's. So if you have that, it's, better to know sooner than later, and you can address it. Ways to address it is looking at determining levels of your B12 and folate. So this testing can be helpful to see what specific type of B12 and folate for your individual needs to help moderate homocysteine levels, which relates to inflammation levels, which again, if you have the E4 relationship with ApoE, the ApoE gene, you want to make sure your inflammation levels are kept in check there, which is a way of preventing things, especially cognitive decline. And then there's medical testing using CT, MRI, PET scans. Okay, brain support supplements. Okay, so things to consider. For one, this is something I really emphasize here, is nitric oxide to consider. Vitamin D with K. Again, D with K helps, both of those elements help with calcium distribution in the right places for our bones to stay healthy. Magnesium also helps with our vitamin D and K metabolism for bone health. B12 folate. So these two supplements are important for methylation, for moderating inflammation. I don't know if you've heard of the term methylation, but it has a lot to do with helping to moderate inflammation. Omega-3s, and some folks do fish oil, and there's also other sources of omega-3s using seaweed. Okay, phytonutrients from red, purple food groups. So eating, blueberries can be good for your brain. Cognitive support options coupled with nitric oxide. So, for some people, taking nitric oxide helps to open up the circulation, and then there's specific support once the circulation's open up to perfuse the tissue, the brain tissue, with specific nutrients to help with cognitive health. Okay, for relatively conscious cognitive health, let's consider the following. Okay, so we just talked about physical things, but let's look at this in terms of a conscious perspective. I think you'll appreciate it. Okay. This is something called the triune brain, coined by Paul MacLean with adaptations by Dr. Daniel Friedland. So he talked about the triune brain, these three parts. So the next parts, we'll go through this slowly, but just follow along with me, is we'll take it from this side first. Just follow my cursor. Now, the green part is your what's called the neocortex, prefrontal cortex. So don't get too lost with the big words here. Prefrontal cortex. This is the limbic system. And then this is your brain stem. Now, each one of these relates to a different aspect of our consciousness. Our neocortex, our prefrontal cortex there, relates to our sense of significance. And if that area is stressed, we might feel insignificant, or another way of saying it, we lose our perspective. Our limbic system relates to our sense of love and belonging, our sense of connection versus disconnection. So a big factor with health, and again with James Naslow's work, is that when people have a sense of loneliness, it really sets the stage for diseases to begin. So it's so important to have that sense of love and belonging, that sense of connection. And that's partly what we're doing with our circle here. And then our brainstem relates to our sense of safety, vitality versus exhaustion. So if our sense of safety is threatened, what will happen is we might be in a creative state, but it will stimulate stress, self-doubt, and cause, you can say, we can put us like in a reactive stance once our safety is actually threatened there, but we have to see what it takes to bring that into check. Same thing with love and belonging here. So let's look at it from here. Our brainstem, just to reemphasize, our brainstem relates to our sense of safety. Our limbic system relates to our sense of belonging. Our prefrontal cortex relates to our perspective, our understanding. So let's look at this next slide. Okay, so again, follow along with me. Let's look at this side first. In the unstressed state, our prefrontal cortex influences the rest of our brain, where we have, you say, tight control of our thoughts. We're in control of our emotions and actions. Our prefrontal cortex has perspective enough to actually balance out whatever is happening. But when we get stressed and we're not handling that stress, what happens is the back, this brain stem, the limbic system start to overpower the prefrontal cortex, and we lose our perspective. We lose our control of our thoughts. We may react, reflexively, emotions and actions there. So this is a picture just to consider. So what does it take for our prefrontal cortex to keep in control rather than our brain, our prefrontal cortex, our understanding part of our brain to be hijacked by our brain stem if someone threatens our sense of safety or if we're threatened by our sense of belonging. So let's look at this slide. Our autonomic nervous system, sympathetic nerves, parasympathetic. Now the sympathetic are the yellow nerves, the parasympathetic are the blue nerves. When we're in parasympathetic dominance, we're in a healing mode. When the sympathetic system is overloaded, these yellow nerves can run hot. Now, you really can't see the difference, but these yellow nerves are thinner than these blue nerves. The blue nerves are the parasympathetic nerves. So the blue nerves are meant to carry greater current. They're meant to run 90 to 95% of the time. That means they can help keep us in a good balanced state. When we're overamped or overstressed, then these sympathetic nerves get overdriven, and they can get fired up, which begin to, you can say in an analogy, why fry our nervous system. So we want to find balance with it all. So looking at it in this, our brain and nervous system is dependent upon our conscious state. So we looked at our autonomic system quickly there. We looked at our triune brain. So a little mnemonic you may want to keep in mind when you may get stressed is, I am safe, I belong, I understand. I am safe, I belong, I understand. Okay, that can help bring us into a conscious state where it can help that prefrontal cortex stay in position where it's influencing our limbic system, our brain stem, to keep things in perspective there. Now, there's other ways to do it too, but this is the underlying physiology behind it. I hope I didn't give you too much there to consider, but we can talk about it some more. Okay. Okay. So in the core, again, the core content on the Conscious Healthy Aging site, you can review the messenger RNA process to clear things as you would. And then let's consider personally. Now, I gave you a lot to consider. So just, part of learning is actually self-reflection. So if you have a piece of paper and pen or something to write on, you can write down some of your thoughts or even write down some of your questions that we can consider now. Okay, Robert's going to play some music for just a couple of minutes. So it's a little self-reflection time to help absorb what I just downloaded on you. Okay. So Robert, you have a little bit of music in that respect. And then let's consider what's been most useful to you for yourself. Maybe you saw some things for yourself, or maybe you thought of someone in your family, or maybe some of your friends. So, okay, so invitation for brain health for the month here. So being mindful on tech, get out in nature, self-fascination, review some of that core content if you've seen that, if that's come across you so far. Prioritize sleep, rest, activity, balance, improve diet, move your body every day, mindful practice, exploring heart math, brain tap, reconnecting your relationships, consider not toxic wise. Again, these are physical things, but I recommend folks get reverse osmosis drinking water because it has the heavy metals taken out. Much of our water supply is tainted with heavy metals, and the EPA allows a certain amount of heavy metals to be in it. But to actually eliminate those heavy metals is having a reverse osmosis water system. Installing shower filters. Now, shower filters emit also heavy metals through the water. It also filters out chlorine there, which can influence the heart and circulatory system. A bedroom air filter to help keep the air in our bedrooms clear. And then consider now engaging with my one-to-one personal individualized care where I can do some specific testing if any of those testing struck you. And I'll be glad to work with each and every one of you one-to-one if you so choose. Okay. So conscious healthy aging, and next session we'll take off for our December session. So I think it's a busy time during the holidays. So the next session will be January 18th. And then those of us who are not on the Conscious Healthy Aging platform, there, if you want to join in, so you have access to all the core content here, you can go